The clinical courses in the nurse practitioner program are probably the most vital courses. It is where students get hands-on experience and can actually apply what they've been learning in the classroom.
The clinical environment is really the place where students are able to put their learning from the classroom and in the lab together.
It's where they see what they're going to be doing when they graduate. It's the most vital part of the program.
Working with a preceptor is honestly the most important part of the program, to be perfectly honest. Without it, I don't really know how we would be expected to be healthcare providers.
When we're in the classroom and doing lab sorts of exercises, I mean, there's all kinds of learning that goes on there, but it just cannot compare at all to the real life, hands-on experience that one of the FNP students has in clinic with real patients.
I feel like I've learned infinitely more in my clinical semesters than I've learned in my strictly didactic semesters.
It's a unique experience. It breaks up the routine of talking with the patients every day. It's another colleague to talk to and to really share your insights and be able to pass on what you've learned.
We recognize that it is very, very difficult to see patients during a busy clinical day and to mentor a student. And trying to be able to put those together is definitely a challenge, but we would ask you to do it anyway.
While it does take more time to have nurse practitioner students in your clinic, it is a great opportunity for you to give back, as well as a great opportunity for you to learn.
Your influence as a preceptor goes way beyond the impact of one student and one student's experiences.
It's something that I recommend strongly to any provider. It's been a rewarding experience for me. It's been something I look forward to, and I know that they would be glad that they did.
I think it would be fantastic if all of our alums were to engage and participate and be a preceptor in their own clinical setting.
Again, this is easy for me to say now as a student, but I hope that I would be in a situation and in a place where I'd be willing to do that when I do have experience and when I feel comfortable, because it's about kind of sending the elevator back down, so to speak, to those people who are still in training and to those people who really would fail without the experience and the expertise of people who are already in the field.
From the gospel perspective, we know that we're put in places where we're to play a role or to answer the prayer of another human being, and I believe that that's exactly what happened under those circumstances in that clinic on that day with that student and that preceptor.
It's really kind of with humility that I approach them and say, I need your help because otherwise I can't do this job.
We need them to help the future of healthcare.